Thank you for tuning in to another Fast Facts Friday. I'm Josh Droppelman, your Patient Experience Coordinator here at Fairmont Regional Medical Center. We're here on site in the operating department. We are here with Dr. Gamponia to discuss glaucoma, the screening, prevention, and treatment. Why don't you tell us a little bit about your specialty?
So I'm an ophthalmologist. I'm trained in the surgery and medical treatment of different eye conditions. And I've been in practice for over 20 years.
What exactly is glaucoma?
Glaucoma is a disease where pressure in the eye affects the optic nerve. And in a sense, the pressure in the eye chokes on the optic nerve head, causing optic nerve damage. And as the nerve gets damaged, people can lose sight. They lose peripheral vision. They get darkening of their vision and so on. Basically, they can go blind.
And why don't we hear much about glaucoma prevention?
Yeah, that's a real good question. I think that's probably a failure of perhaps medicine to not make glaucoma more aware. I think that the more people, what people don't really realize, I guess, is that there are about 3 million people that get diagnosed with glaucoma every year, and half the people really don't know that they have glaucoma, I guess. So they have the condition, they don't really realize they have it until there's already advanced vision loss. And I think that's probably failure of medicine to educate people to understand what glaucoma is and the importance of actually being screened and being checked for it.
Okay. And who is at the greatest risk to get glaucoma?
So there are populations that are at higher risk of developing glaucoma than other populations. Certainly those people who have a family history of glaucoma are at huge risk. Diabetics are at risk. People who are very nearsighted are at risk. Family history is probably the greatest risk factor.
Okay. Let's say I'm 30 years old. What should I worry about when it comes to glaucoma?
That's a real good question. I think the important thing is to have an eye exam by an eye care provider, whether it be an optometrist or an ophthalmologist, to be checked and screened for glaucoma. It's probably not a bad idea at the age of 30 to have a good, thorough eye exam anyway. Most people who are at risk for glaucoma may not develop glaucoma until later ages, usually after the age of 55. But it's a good idea to have a good eye exam right around the age of 30.
Now, is there any signs, symptoms that we could look for?
And that's what makes glaucoma somewhat dangerous, is that with glaucoma, there are no signs or symptoms until the disease is actually very advanced. It's a silent disease, and that's why a lot of people don't really realize they have it until it's too late and they've lost vision already. So it's still very common. I'll see patients that come into my office thinking that maybe they need glasses or they've got a cataract and they have some vision loss, and lo and behold, we find that they have glaucoma. And now all of a sudden, their vision loss is irreversible. We can't get the vision back. We start treatment with drops and maybe even might require surgery to treat. But there are still patients every year who come in thinking they just need glasses or contacts, or they've got a cataract, and lo and behold, they've got glaucoma, and now they have very advanced vision loss, and there's no way to prevent the disease there's no way to get the vision back, basically. Once the optic nerve is damaged, then you can't really undo the damage.
All right, you said previously that we should get an eye care professional to get checked out. Now, does our primary care doctor would happen to examine us for this if we go in for like our yearly physicals?
So, that's a real good question. In order to screen for glaucoma, you need to have a few tests that involve measurements of the eye pressure, looking back at the optic nerve head. And while I believe there's probably some primary care doctors can do this, I would say most are not well equipped to screen patients for glaucoma. There are probably some very good primary care doctors that understand the risk factors and can encourage patients to get in to see their eye doctor once they find a patient has risk factors. And certainly I think that if a patient comes in to their primary care doctor complaining of vision loss, I think the primary care doctor is probably going to be very quick to recommend a good eye exam by an eye doctor.
And what are some of the treatments for the glaucoma? You said eye drops before.
Yeah, so there are different methods of treating glaucoma. One treatment is basically eye drops. There are several different eye drops on the market that are very good at lowering eye pressure. There's also laser treatment that can be done to help lower eye pressure. And then in very advanced cases, we have glaucoma surgeries where we can, in a sense, create drainage structures in the eye to help drain the pressure off the eye to help control glaucoma.
Okay. Out of everything we talked about today, what would be the one thing that the viewer should take from this about glaucoma?
So I think there's some very important points. One is glaucoma is a silent condition, and it can cause irreversible vision loss or blindness. Patients don't really know if they have it or not unless they're examined for it. And it's important to have routine eye exams performed to screen for glaucoma. People at risk are people with a family history of glaucoma, people who are highly nearsighted, diabetics, people who have had multiple eye surgeries are also at risk for it as well.
Perfect. Thank you very much. I'd like to thank Dr. Gamponia for being here. He's with Regional Eye Associates. Stay tuned next Friday for a new edition of Fast Facts Friday.
Thank you.